I ended up having to order a pulse oximeter for this next video on how to kind of control your own anxiety. I also learned that acrylic nails don't work with a pulse oximeter. So luckily my child Sam was willing to volunteer for this. And this is one of the most basic forms of biofeedback, and you can do it at home. When you have anxiety, yeah, there are ways to handle that without medication, which I'm not anti-medication whatsoever, but it does take diligence and you need to do this day in and day out. So it would just kind of become part of your routine. Sometimes attach it to something you're already good at. Maybe when you brush your teeth, you're going to work on your breathing with the pulse oximeter. The big thing is to find a target to bring your heart rate down. You do need to start just thinking of a situation that was maybe a 7 or 8 out of a 1 through 10 scale that was causing you some extreme anxiety. In the video, you'll see that talk about Sam's recent car accident. Sam's also sick, so their heart rate's a little bit all over the place, but you can still follow along and see how this technique works. All right, so Sam's heart rate is 93 when thinking about the accident. So what you're going to do is you're going to continue to look at the pulse oximeter, and you're going to take a deep breath in for 4, like hold for 4, and then you're going to blow your air out for at least 8 seconds. Kind of pretend like you're blowing your air out through like a coffee straw. Then you're going to hold for 4 with the exhale. Now you're going to inhale for 4, hold for 4, and exhale as long as you can, slow as you can. And just keep watching your heart rate on that monitor. And you'll keep doing this, like, because 93 was where you were when you were thinking about the wreck and how you felt. A good target to try to drive your heart rate down to would be about 75, but also because you do a lot of exercise between dance and gymnastics, so you have a pretty low heart rate. So you'd keep doing that. You should see your heart rate go up on the inhale and the hold when it's full, and then as your lungs let go of the air as you exhale, you should see your heart rate go down. And you want to watch it on your pulse oximeter, because that gives the biofeedback to your brain to let you know that you have calmed your heart rate down. Just because we don't detect our heart rate doesn't mean that our body doesn't. So it's best for you to look at it. You have to breathe in for 4, hold for 4, blow out your air as long as you can. If you can do even 12